Good evening and welcome to our COVID-19 update. I am Ladi Akiriduluale. Here are the highlights at this hour. Presidential Task Force on COVID-19 releases midterm report, promises more concerted action on challenges experienced with the spread of the virus. Health Minister says Cross River State has finally agreed to allow for conduct of tests for COVID-19. And leaders in the U.S. state of Texas call for statewide lockdown as it records more than 27,000 cases in 24 hours. The Presidential Task Force on COVID-19 today resumed briefing in the Federal Capital Territory, Abuja, where its chairman, Mr. Boss Mustafa, reiterated the commitment of his team to ensure that Nigeria curtails the spread of the novel pandemic. Mr. Mustafa explained that government at all levels frowns at all acts of non-compliance to safety protocols by citizens, as this is the only way of flattening the curve of COVID-19.
An enhanced risk communication strategy becomes inevitable when we realize that within the last 24 hours, the world witnessed the largest single-day cases of 230,370, while in Nigeria, the last week recorded the highest weekly fatality of 70 deaths. The rising fatalities in Nigeria is not unconnected with denial and delay in seeking help. You can see, in spite of the trillions of dollars that is invested worldwide, we recorded in a single day the highest number of cases since the outbreak of COVID-19. Three major reasons why COVID-19 is spreading fast, and it reads thus. A, they are my colleagues, so I can speak without a mask. They are my close friends, so I can speak without a mask. C, they are my relations, so I can speak without a mask. These three situations presupposes that you are lowering your guard or ignoring basic danger. This message is so poignant that if we juxtapose it with the fact that crowded places and closed spaces create environment for the spread, we should behave more responsibly.
The chairman of the PTF on COVID-19, Boss Mustafa, putting out part of the midterm report of the PTF. Meanwhile, its national coordinator, Dr. Sani Aliyu, has asked public and private sector managers to deny anyone without a face mask access to their premises. Dr. Aliyu explained that with a review of the guidelines for the phase 2 of the eased lockdown, there is the need for all to adhere strictly to all laid down protocols across operational sectors.
In terms of curfew, we continue to maintain a nationwide curfew from 10 p.m. to 4 a.m. For transportation and travel, both interstate and intrastate, movement across state borders is allowed, but only according to curfew times. Vehicles should preferably be for short distance trips. The windows should be preferably open. Observation of non-pharmaceutical interventions is critical, and in this regard, the PTF is strongly recommending that those above the age of 60 years stay at home, and not only stay at home, but avoid interacting with other members of the public outside their immediate bubble. The aviation industry has resumed limited domestic flights with the provision of sanitizers and appropriate PPEs. They also have designated areas and procedures to isolate passengers with suspected COVID-19 infection ensure crowd control and queuing discipline so that we have social distance maintained, as well as providing additional training for COVID-19 staff and all other non-pharmaceutical interventions. We are pleased with the measures put thus far by the Ministry of Aviation, and we will continue to work with aviation as well as the general public to ensure that this does not pose a risk when it comes to increased transmission of COVID. Linked to this is the need to make sure that people wear face masks in public. And again, we would like to emphasize the principle of no mask, no entry, no mask, no services should be provided in public spaces, including government offices, as well as the private sector.
The Cross River State government, in the meantime, has finally allowed for testing for COVID-19 cases within the state. This was made known today by the Health Minister, Dr. Osagie Ehanire, while briefing newsmen at the PTF briefing. Dr. Ehanire says the testing center for this would soon be set up in the state.
I am pleased to report that Cross River State is now aligned with the Federal Ministry of Health COVID-19 response and has started reporting on the national dashboard. We have activated the Gene Expert machine at the University of Calabar Teaching Hospital to increase testing capacity in the state. And NCDC has resumed deployment of rapid response teams to provide technical assistance to their public health EOC to strengthen their incident management system. Following the intervention of this ministerial team with the Cross River State branch of the Nigerian Medical Association officials, issues that led to their withdrawal of medical services by doctors in the state were resolved, and the strike action has been called off. We plan to replicate this success in Cross River State with other states of the country where the need for policy alignment is found to be wanting.
Moving on to global research to establish whether or not COVID-19 could be airborne, the Director General of the Nigeria Center for Disease Control, the NCDC, Dr. Chikwe Ihekwezu, says this cannot be ruled out as new evidence emerges on a response strategy.
For COVID-19, from the very beginning, our understanding based on other coronaviruses was that spread was primarily through droplets. Droplets are excretions from the respiratory tract that can't stay on in air. They obviously ultimately fall to the ground after a few minutes. However, as we have studied transmission, studied clusters of these infections, we saw increasing evidence from clusters of infections where droplet transmission did not seem to be enough to explain the clusters that we are seeing. Over the past few weeks, increasing evidence has emerged that in addition to droplet infection, we cannot rule out that airborne transmission is also possible as a mode of transmission of COVID-19. And WHO has released updated its guidelines on this, saying exactly the same thing, that we cannot rule out airborne transmission, and therefore we have to act in a precautionary way, assuming that this is also possible given the new evidence that is emerging. There's a bigger challenge, and what we're doing, there's an online platform that is being set up at the moment to enable the electronic transmission of results back to patients. So we've been working very hard on that. So that should launch over the next few days, hopefully by the end of the weekend, where you can go in yourself and check your result once you've been tested, and you have a code that is given to you. So we're working very hard on that so that anyone that knows his own code can go and check your result and know what it is, so that we don't rely on several steps between federal lab and state governments in order to share those results.
In Lagos, efforts to resolve the warning strike declared by the Medical Guild is currently ongoing, and that is according to the chairman of the Guild in the state, Dr. Olujimi Sodipo. Yesterday, the Guild declared a 3-day warning strike from today over issues they say affect their safety and welfare. Members working in the state's COVID-19 isolation centers are, however, exempted from this particular action. According to Dr. Sodipo, who was a guest on our COVID-19 update program earlier today, the talks followed the intervention of relevant authorities in the state.
Our major concern truly has to do with ensuring that the welfare of the members are looked into so that the members could actually look after the public, which is our primary responsibility. We take this issue with all the seriousness that it deserves, and that was why the decision that was taken took into consideration the fact that we might not be able to achieve everything that we want, but the most important thing is that we start these discussions, we keep the discussions going. I think the challenge that we had was somewhere along the line there was a break in communication, because following the first ultimatum, the reason why it was extended was to give an ability for all parties to meet and keep on meeting, because the challenges are unfolding. So we've started the discussions. I wouldn't want to mention any specific thing here, but anything that would have to cater for the welfare of the medical doctors, other healthcare workers, and of course, in generality, the citizens is what we are looking out for. And we just hope that, as I said, within the shortest possible time, we could have a peaceful resolution to this and a permanent one. And we go back to what we are used to doing, which is saving lives.
Minister of State for Education, Mr. Emeka Nwajuba, says the Presidential Task Force on COVID-19 has produced a 52-page document putting together guidelines on the possible reopening of schools in the country. Speaking today at the PTF briefing in Abuja, Mr. Nwajuba urged every Nigerian to acquire the document and assist in reviewing it before its final publication.
We've had 26.
Is in 10 parts, the introductions, the forward, and everything. But at chapter 6, where we deal with the steps that need to be taken for schools and other learning institutions to be safe enough to open, and if they open, what they must do to stay open, and how they will proceed with that process. We are willing to share the document, Chairman, right? Yeah. Okay. The Chairman says the PTF is now willing to share the documents. They've assessed all of it, because in its preparation, the NCDC, the WHO, and everybody has given their guidance. So it will be some sort of document. Like I said, it's a 52-page document, and I would think it may be nice for you to get copies. Then you can help us X-ray it.
Let's go to the nation's capital now, Abuja, where we're joined on the line by Professor Suleiman Bogoro, who is the Executive Secretary of the Tertiary Education Trust Fund, TET Fund. Professor Bogoro, thank you so much for your time. Welcome to our COVID-19 update.
Thank you so much.
The issue of research, just last Friday, the federal government announced that an indigenous test kit had been discovered, had been manufactured, and then it spoke to the issue of research and funding for research across many fields, given what we now know about pandemics, and COVID-19 is not the first and it will not be the last. What is the role that an organization like yours plays in this? Because there is a link between your organization and the academics who are supposed to be deeply involved in this research.
Yep. Thank you Thank you very much. Yes, there is no doubt about it. I spoke to your station about 1.5 months or thereabouts ago, and it was on the issue of research. And yes, we are supporting or funding public tertiary institutions, precisely university, polytechnics, and colleges of education. And you will agree that tertiary institutions are traditionally, and specifically university, leaders of research. And our research supports all disciplines across areas of need, as we know. And at this particular time, in the COVID lockdown and challenge, as it were, a global pandemic, we have reflected over what we've been doing. And as it were, the National Research Fund of TETFund has been involved supporting research. And I said it earlier, and I want to repeat, presently, we are holding the largest research grant in both public and private space in Nigeria. And we are happy to do what we've been doing. And because of the importance of research, you will notice that across the world, each time there is discussion about the challenge of the virus, COVID in particular, and of course other viral diseases. And we know in Nigeria, we easily reflect on Lassa fever and Ebola, of course. You could not address them without research. Research for the production of, if it were possible, cure. But ultimately, like I would like to say always, getting a vaccine for preventive purposes, raising immunity levels in those that are targets of the viruses, as it were.
My apologies. Let me interrupt and ask you something quite specific. It appears as if in two areas we're in need of funding for research. The possibility of getting a vaccine or some kind of therapeutic solution for COVID-19 is one. And then secondly, the production of personal protective equipment, things like face masks and the gowns that doctors wear and all of that. How much has TETFund done in these specific areas?
Thank you very much. Yes, TETFund, not in respect of PPEs, personal protection equipment, that has been much less of our priority. We have been involved deeply in supporting research in respect of therapeutics and, of course, vaccine. As I talk to you, on the instruction of the Minister of Education, Mala Adamu, on further guide by Mr. President, and as we know is required by the daily briefings and details dished out by the PTF, TETFund has been able to support 6 research grants with a total research grant of nearly 300 million naira, about 280 or thereabouts. And these research initiatives are mainly from our universities, and I can precisely mention them. The University of Ibadan, Usman Danfodio University, Sokoto, University of Jos, Nnamdi Azikiwe University, Oka, NAFDAC, and the Nigerian Academy of Science that coordinated about 4 research grants across some universities with partnership between them across the country. And definitely, we are hoping, as it were, that we know most of their emphasis have been on therapeutics. As it were, we look forward to the outcomes, and we are still open to supporting more, including one that will go to the fundamental for production of vaccine. But it's a continuation of what we've been doing. TEDFund has been supporting research across the various disciplines as well as, but specifically with emphasis on STEM. We are happy to play our role, and we hope to continue to engage our researchers that are putting up questions. You will recall that only about some few weeks ago, we put up advert for concept notes for research grants, and our research grant has a ceiling of up to 50 million per grant, and that is for the National Research Fund, which is managed by some of our best across the disciplines.
Professor Bogoro, I'm going to have to interrupt again. We want to thank you so much for time. We've run out of time at this point, but I want to thank you so much for the enlightenment on the efforts, especially in research and grants. Thank you for your time this evening.
Thank you so much.
Let's take a break at this point. When we return, we'll take a look at the most current figures and what is happening in the NCDC Situation Room. Then we'll expand the discussion. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. And once again, we're back at the COVID-19 case monitoring dashboard here on Channels Television. 571, that's the number of new confirmed cases of COVID-19 that has taken the total number of confirmed COVID-19 cases in Nigeria to 32,558, as announced by the Nigeria Center for Disease Control, the NCDC. 344 people were discharged in the last 24 hours in 14 states, bringing the total number of COVID-19 patients that have recovered to 13,447. With 16 deaths recorded within the last 24 hours in 4 states and Lagos accounting for 12 of those fatalities, the total number of deaths owing to coronavirus in Nigeria is 740. Of the total number of confirmed cases in the country, 21,385 are male and 11,173 are females. The most affected age group continues to be those in the 31 to 40 years age bracket. Community transmission continues as 74% of the total cases are from unknown exposure. A breakdown of the regional figures shows Lagos, which is the epicenter of the disease in Nigeria, is leading in the southwest. The FCT is leading in the north central. In the northwest, it's Kano. In the south-south, Rivers, while Ebonyi takes the lead in the southeast. Now, let's take a look at one of the states, like we have done in the last couple of days. And that state today is Edo State. Now, these headline figures are the figures from Edo State as at today. 1,731 confirmed cases, 700 active cases because 974 people have recovered and 57 people, sadly, have passed on. Quite naturally, and that's because the testing has also focused around there. Benin City, which is the capital of Edo State, is a big hotspot in the entire state. Although there have been infections, the local government breakdown is also here. Point of caution, though, these figures from the local government are as at the 6th of July. These figures, of course, indicate that Oredo local government has 456 cases. This is as at the 6th of July. But there are other clusters there, as you can see, around Benin, all the way up to Auchi and a number of other places. There are smaller clusters, red spots. That's Edo State to date. Other local governments in the state, of course, have their numbers as at the 6th of July. Once we have updates on other states, we will bring them to you. But from Edo State, let's stay in the south-south, where we go to Bayelsa State, where the government today announced a penalty for anyone caught without a face mask in public places as a measure to curb the spread of COVID-19 in the state. Deborah Timiwood has more.
Over 1 month ago, the Bayelsa State government, as one of its measures to curb the spread of coronavirus in the state, launched the Operation Max Up Bayelsa, but most people refused to comply with the directive. today, the state government has instituted a fine against the offenders. Anyone caught in Bayelsa State not wearing a mask in public places will be made to pay a fine of 20,000 naira or face 6 months imprisonment.
The way the coronavirus increases, everybody they wear face masks for public places is very, very important. Mostly inside this kekese, they're okay well by me.
So I plead with the government to make consider us like our health. Person like me, if I wear this face mask like 2 hours, I know if you breathe, well. And they say without the face mask, they will arrest you.
The compulsory face masks in the States is a good measure to make sure to protect us from this COVID-19 that is in the States or in the country right now. I think it's a good move by the government of the state. It's a good move.
Since the event of these nose masks, boys actually use it to steal. Because now we don't know who is who in the streets again. The faces are not showing. Everybody put on face masks. Now, caught boys use it to steal in Bayelsa. So if government can actually bring out a security outfit to checkmate all of this, I'll be very happy to Bayelsa government.
Bayelsa today recorded 14 new cases. At the moment, there are 142 active cases of COVID-19 in the state, and 153 persons have already been discharged. The state has also recorded 18 deaths. From Yenagua, Dobra, Timiwood for COVID-19 updates.
Last week, the federal government of Nigeria announced a newly developed and validated indigenous test kit for the identification of SARS-CoV-2, the causative agent for COVID-19. Now, how viable is this indigenous test kit, and what positive impact will it have on the country's national response? I'm now being joined on the program from our Abuja studios by a medical lab scientist who is also a health systems expert, Mr. Musa Wazani. Mr. Wazani, thank you for your time. Welcome to the program.
Very much. Now,
sorry, just before you go on, I think you should actually allow me to ask a question first. My first question is, what do you make of this new test kit? Is it the solution, as it were, to our testing challenges, do you think?
Not really, but it's encouraging in the sense that generally speaking, most of the test kits being used in the testing of COVID-19 are being imported. So for indigenous experts to start producing local content test kits for the testing of COVID-19 should be commended. And beside that, before now, the medical laboratory scientist has produced also what you call viral transport medium, and is being deployed and is being used in the transport of sample collected from COVID-19 positive or COVID-19 sample collected to the testing center. So for test kit to be produced locally is something that we feel it will add a boost to the fight of the scourge of COVID-19. Beside that, we should be encouraged also to produce other local materials like the swab stick that we use to collect sample for COVID-19 testing is being imported through SMEs. If we encourage local professionals, experts, like medical laboratory scientists, they will be able to produce more of this, and it will help in the area of logistic management and reduce the cost of testing through the productions of local content, thereby bringing down the prices and bringing down the logistics challenges associated with the import of these testing materials. But
let me ask you this.
So far,
sorry, I wish to ask. Let me ask you. Let me jump in and ask. You're a medical lab scientist, and possibly from that perspective, you can explain to us. There are other countries, even on the continent of Africa, that use kits that are said to be faster in getting you results. We are said to be using the more slow but yet more accurate ones. Is that the way to go, considering the large number of people that we have to test and the challenges that you've just enumerated?
Now, if you give me a little time, I will explain this to you. The major challenges of using rapid diagnostic test kits is in the area of accuracy. Accuracy is the function of specificity and sensitivity. What I mean is that the rapid diagnostic test kit will not give you instant situations that is happening within the patient. Let me give you an instance. If you have somebody that have contracted the COVID-19 virus, it takes a time for the viral particles to increase, for the rapid diagnostic test kit to be able to pick from it. But when you talk about PCR, the PCR method we use, even if one is exposed with a little dose of the virus, the method we employ here in Nigeria, the PCR base, it will amplify it into multiple copies, thereby extracting a particular portion of the genome, and you will likely get positive. But if you use the test kit, whether you are looking at antibody base or antigen base, it takes, if one is contracted with the virus, it takes about up to a week or 5 days up to a week for antibody to show in the bloodstream for you to be able to dictate. So what happened within that period of time, from when the person gets contracted to when the antibody will be formed in the body for you to now get it tested. Before that time, the person is likely to spread the COVID-19 infection to the community. And beside that, if you are also looking at antigen base, you need some viral load of the antigen for the test kit to be able to pick. But if you are looking at the PCR base, if one contracts the COVID-19 within a short period of time, maybe a day or two, the PCR-based technique will be able to amplify it and give it positive. And I want to also state that even the WHO today is yet to approve the use of rapid diagnostic test kit because of these inherent challenges with the testing.
Okay, and thank you so very much, Mr. Musa Wazani. Thank you so much for your time. Mr. Wazani joined us from our Abuja studios and is a medical laboratory scientist and health system expert. Thank you very much. Switching gears from there, we go to a public health physician who is also an epidemiologist in the Department of Community Health at the Obafemi Awolowo University Teaching Hospital, Ile-Ife, Osun State. Dr. Olukem Olugbade joins us via Skype. Good evening, Doc. Thank you for your time. Welcome to the program.
Good evening, Mr. Ali. Thank you. Good evening, viewers.
The PTF is giving its midterm review, and in that review, they're pointing to the fact that the biggest single challenge that they face in helping or in trying to contain COVID-19 is simply this issue of non-compliance.
Yes, that has been a major issue across the country. And part of the reason is because if we look at the trend of compliance with public health interventions in Nigeria over time, we have found out that it has been a challenge for people to comply with interventions that are even beneficial to them. If you look at compliance with use of seatbelts, many people don't use seatbelts until they're approaching, where you have road safety officials or use of helmets. You know, our contraceptive prevalence rate is about 17%, even when family planning methods are free. Immunization coverage is 2.5%. So it shows that compliance over time with public health interventions has been a challenge. So with use of face masks social distancing, physical distancing, precautionary measures. It is not unexpected. But what we need to do is to improve enlightenment education. And recently, we've seen that enforcement has been added to the interventions across different states. But this also has to be done with caution so that you don't discourage people. And with our law enforcement agents, also for them not to be, over difficult with Nigerians, because when you criminalize some of these things, they become even more difficult to adhere to. Now, I would want us to look at the successes we've had in immunization, which has helped us to, as at now, get qualification for eradication of polio. So what were the success stories and best practices in immunization? Community engagement, risk communication. Let us go down to the grassroots. Let us involve youth leaders, women leaders, religious leaders, community leaders. Let us go to the points of entry and improve our testing in those areas. Let us look at points of travel. We can do at the national level, there can be and state level, there can be collaborations with Nigerian Union of Transport Workers, Road Transport Employers of Nigeria, because we see that a lot of people who travel don't take precautions. There's no social distancing or physical distancing in the buses. We don't see people using face masks when they travel, and these are the things that enhance community transmission. So we need to collaborate with market women and artisans, masons, people in the informal sector, because we've seen that these are the people that compliance in them has been a challenge. If you look at what you see on social media, it's what you see on the street.
Ask you this, Dr. Olugbade. Let me interrupt you and ask you this, Dr. Olugbade. Across the world, especially in the hotspots, we're seeing rapid increases, geometric, some would describe it, increases in the number of cases. In Nigeria, maybe what we have is not quite geometric yet, but we're having fairly rapid increases, numbers oscillating between 400, 500, 600 a day now. So this is now becoming urgent, isn't it? So that the health system is not overwhelmed.
Yes, it's urgent, it's worrisome, and the truth is the health system is getting overwhelmed already. But we have to be proactive, and we should look at our data. The reason why I think community transmission, the number of cases are increasing, is because there's continuous asymptomatic transmission. Apparently, healthy people are still moving around and transmitting the virus. And the challenge with these apparently healthy people is that even though they're transmitting the virus, they might not get as ill as people that are transmitting the virus to. Because evidence has shown that just about 60% of cases, 60% of cases are mild to moderate. Only about 20% will require admission if they have moderate illness, and about 10% severely ill. So those people who are the 60% who are asymptomatic are the people who are causing death in the 10% who will become severely ill. So we need to protect our vulnerable populations, the elderly, people with chronic medical conditions, people who are, hypertensive, diabetic, sickle cell disease patients, people on cancer treatment, pregnant women. Okay, so those are the populations we need to protect, and then we need to test more. The reason why testing is important is because you'll be able to identify where the clusters and where the disease transmission is coming from. So we need to segregate our data down to even the ward level. So we have seen where across the country the LGAs are most affected, and then we do, like it's usually done in immunization when there's an outbreak. You do what is called reactive vaccination for maybe epidemic-prone diseases, e.g. measles. So now, for those places, for those LGs where we've seen this high cluster of cases, we can do testing in a 5 to 10 to 20 kilometer radius and identify exactly where these cases are coming from, where the transmission is ongoing, and then respond effectively. Okay, so we can test. We can isolate people that are transmitting asymptomatically and then break the chain of transmission. So
Dr.
until we do
Olukemi
this and
Olugbade,
look at
thank you so
isolation,
much for your time. We're going to have to leave it there. Thank you so much for your time. Dr. Olugbade joined us via Skype from Ile-Ife in Osun State.
thank you very much.
Amidst spiraling cases of COVID-19, South Africa's President Cyril Ramaphosa has announced that he is reimposing a ban on alcohol sales as well as a curfew. South Africa had imposed a ban on alcohol sales and a nighttime curfew as the country suffered a rapid rise in cases of COVID-19. The president's government had imposed one of the strictest lockdowns in the world in late March, but has since eased those restrictions amidst concerns for its struggling economy. Our South Africa Bureau Chief Betty Dibia has more.
20 million screenings, over 2 million tests, and many great anti-COVID measures later, here's the current COVID-19 picture in South Africa. And President Cyril Ramaphosa says, yes, the storm is upon us.
It is stretching our resources as we speak, but it is also stretching our resolve to their very limits.
The president says while government admits measures that have been taken are not perfect, South Africa still has a mortality rate below 2%, way below the global figure of 4.4%. To the people, he says, everyone must get a bit more responsible in the anti-COVID fight.
As we now approach the peak of infections, we need to take extra precautions and tighten existing measures to slow down the rate of transmission.
Some of the measures include a 9 p.m. to 4 a.m. curfew and an immediate ban on the sale and movement of alcohol.
No, for the people who are drinking, I don't think it's good, and it's not good for the economic. That speech, me, I like it because he is trying to save our life.
What you said about the alcohol, in some instances, it will help, but in most cases, it's not alcohol, it's the people.
The national state of disaster has also been extended till August the 15th. The relevant ministers in the National Command Council gave more details on the modified regulations, which has still left some more confused than others and some more determined to find and exploit loopholes. Local community mobilization is to begin with ministers and community leaders at the head to curb the spread of the virus, especially in the 52 identified hotspot districts across the country. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
So Betty joins me now via Skype from the capital, the commercial capital, that is Johannesburg. Good evening, Betty. Thank you for your time. It seems as if the government in South Africa walked back. It seems as if they walked back a little, particularly on the issue of targeted lockdowns.
Well, not exactly. Everything is almost the same. But what the president has said is that they will be tightening or enforcing more of the regulations already in place in order not to harm the economy any further. The main thing that has changed is a step back regarding the sale and movement of alcohol, which has brought all sorts of problems as well. According to those who are in the industry and then those who drink alcohol. So that's the major change. Major change is the issue of non-sale of alcohol. And then now they've yielded to the taxi industry. They can now carry up to 100% capacity. Before they were insisting that it had to be 70%. But 70% for interprovincial movement, but 100% for short distances. I mean, remember that there had been a problem over, should we give you 1 billion rand to support the industry, but the taxis insisted on 5 billion, and government said we don't have that. Then the taxis said, no, if you have to have it that way, then we'll go ahead and go with a 100% capacity for passengers. So government yielded to that, provided that they adhere to the strict reduced risk measures for carrying people in order to curb the spread of the virus.
Given all what you've said so far and the fact that all along many of these measures had been litigated in the past, many people went to court over the sale of alcohol or non-sale, the sale of cigarettes and non-sale, the curtailment of movement and so on. Is the government kind of threading a balance between trying to appease the people, for example, on the issue of attendance at funerals, and then trying to keep public health on a kill with the issue of alcohol?
They're trying to, in essence, government is trying to not totally shut down the economy, but to also keep people safe. We've seen an average of 12,000 increases in the number of confirmed cases in the past 2 weeks or so. For the 4,172 deaths that we have, a quarter of that just in the past week. So the issue of alcohol, that's a different case. They're appealing to people and they say they're going to keep or enforce this more, the issue of attending funerals. Here, funerals are taken very seriously by the people or culturally, and people are breaking the rules daily where you have over 100 people, whereas government has always stayed on 50 and 50 alone. So many of the funerals that you see of some top officials or prominent people that we see on TV, people adhere to that. But in those local areas or rural areas, people want to say goodbye and probably what they call after tears, where they have lunch after the funeral ceremony. You have hundreds of people gathered. So people are breaking the issue of masks. People are not keeping to that. They're saying they're going to send ministers and non-governmental organizations, religious leaders as well, to go into the communities now to, help people understand that, look, this is all for your safety and the safety of the people around you. So that deployment is going to happen. And then probably the law enforcement agencies too will focus on people the more to ensure that people adhere to the regulations, because that's the only way to slow down the spread of this virus.
Nice talking with you, Betty, and please do continue to stay safe out there. South Africa Bureau Chief Betty Dibia on line from Johannesburg. Leaders of Houston and Texas are calling for another statewide lockdown after COVID-19 infections rose by more than 27,000 yesterday. Leaders on social media supported the need to stay at home, disagreeing with the state governor's efforts to reopen schools. This comes just as the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, says the pandemic is going to get much worse if certain governments do not take decisive action to curb the spread of the disease. At the agency's daily press briefing today, Dr. Tedros says mixed messages from leaders were undermining public trust in an attempt to bring the pandemic under control. With more than 13 million people having contracted COVID-19 now globally, Mexico has passed Italy to record the fourth highest death toll in the world. That's our package this evening on our COVID-19 update. Thanks for being with us. Do go to all our websites. The NCDC website has details of the figures you've seen on the program tonight, and indeed other figures, as well as response strategies from national and state levels. The World Health Organization also has updates on all the studies that it is conducting on COVID-19 worldwide. It has reactions and responses at national and international levels to COVID-19. And of course, channelstv.com is your home for the news, not just news about COVID-19, but news about everything else. I am Ladi Akiridulwale. Good night.